Good afternoon. I'm going to present my study, Sepsis at ICU Admission, the Prevalence, the ICU Mortality, and the Determinants of Mortality in the Intensive Care Registry of Uganda. Those are my supervisors. So sepsis remains one of the leading causes of morbidity and mortality worldwide, with an annual incidence of 276 to 678 per 100,000 people. Of these, 22.5% to about 26.7% die. In the ICU where we get patients, the global prevalence is around 31%, and mortality ranges from 30 to 46, depending on the region, the type of ICU, among other things. So in the LMICs, our ICUs are poorly equipped. This is known information. And mortality has been noted to be as high as 80%. That was in a study in Congo, which has a similar setting to us. Okay? So in Uganda, sepsis and in-hospital mortality has been as high as 58.9%. This is in the hospital, not specific to the ICU. This study is by Kwizera et al., and it looked at general ICU mortality to be at about 40%, and sepsis was listed as the most common diagnosis, in about 49% of those patients. Associated factors included older age, altered mental state, thrombocytopenia, among others. So this study aims to sort of guide clinical management using locally collected data, guide resource allocation, and policy in management of sepsis. So this is my general objective, and the specific objectives. One will be to determine the prevalence of sepsis at admission among adult patients admitted to the ICUs in the registry, determine the ICU mortality of patients admitted with and without sepsis. So it will be more of a comparison, because these patients are going to be receiving almost the same, like I'm looking at the burden in those with sepsis and those without sepsis. Do they die more? Do they utilize more resources, among others? So how important is the study to patients? It will help, will identify high-risk patients faster, and so will prevent them from dying or progressing badly. Then to the clinicians, we'll have evidence to guide our decisions. Then to the policymakers, we'll know which resources to allocate to critical care settings. Then for researchers, this is a baseline study that can be used for future studies. It's going to be a retrospective cohort. Study period will be 2022 to 2025. And the study population will be all adult patients. We'll use all patients. And we need to power the study, we need 1,186. However, we are going to collect all eligible patients into the study. That's what we'll use for data analysis. Yeah. We are now going to we have IRB approval. We're progressing to start analysis after getting the data. Thank you.